Investigating a case of SIDS or investigating a case of SUD, that is sudden infant death syndrome or sudden unexpected deaths, is quite a complicated case for a forensic practitioner or for any chemical pathologist when he's working with. There are a lot of external findings in such a case, and sometimes the autopsy proves to be negative. It can be a negative autopsy, and it has to be a negative autopsy whenever we are terming any death as sudden infant death syndrome. So this negative autopsy is sometimes quite tricky to perform. So concluding the SIDS phenomena and concluding the SUDS phenomena, the autopsy working as a forensic practitioner, if whosoever is performing the autopsy in such a case, the crime scene investigation is the mainstay over here. First of all, you have to get the overview of the house. The environmental factors, they basically come into play whenever we are investigating such a case of SIDS or such a case of SUDS. So it is very important that the autopsy features to the medical practitioner, to the medical officer, to the medico-legal officer, he should be clear what will be the autopsy features in such a case. Again, sending the samples of the lungs, the brain, and the liver to the kidneys, as well as the kidneys to the chemical pathologist. It's very important that he should look for the signs of SIDS as well. The bolus of foods, the aspiration is sometimes concluded in such samples. So in this section, we'll be discussing the SIDS autopsy. So how is it performed? What are the signs? What are the findings that are usually found in such a case? Autopsy appearances are again very important over here. And we'll be discussing that these autopsy appearances are again very important when we are discussing these syndromes. Now, SIDS autopsy that is usually performed, it is the exclusion of the child abuse. So on external findings, there are no signs of violence because, as we've already defined, the battered baby syndrome, in which we have signs of abuse on an individual who is less than 3 years of age. So the definition of a battered baby syndrome basically includes the age group less than 3 years, and whenever we are talking about SIDS, it's the age group less than 1 year. So basically, it can come under the battered baby syndrome. Sometimes this abuse proves to be fatal for the infant. So it's usually an occult abuse and a genuine accident. So if the abuse is negated and there are no signs of abuse, no signs of violence are seen in such a case, the whole body post-mortem imaging is done in such a case. It can be CTs and CT slicings or MRI slicings. They are done in a lot of cases. So this is quite important over here. Then we have the radiological survey before the autopsy. Before the autopsy is performed and even after the autopsy is done, the samples are sent to the chemical pathologist and the full measurement of the infant is done. So the lengths are taken from the crown of the head to the heel, and these are the lengths that are very important. So the gross examination of all the external surfaces, specifically the orifices and the organs, the full histological survey is done in a lot of cases. The histology, how is it done? It's usually the swabs are taken from the major air passages and the lung parenchyma for microbiological cultures. So this is the technique basically that you will be sending the swabs from the air passages. The respiratory passages are involved in such a case, and these swabs are going to indicate towards any respiratory infections or the pneumonias. They can be revealed by such swabs. Then we have the heart blood cultures. So if it is a case of septicemia, it will be revealed at this level when the blood culture is taken from the heart. So even the valve defects are highlighted over here. The middle ear infections should always be opened. The middle ear is open in such a case to reveal any middle ear infections, and a swab is taken if infection is suspected. So whenever you're performing any procedure, you're basically suspecting something at the back of your mind. It's again going to be very important that what is the technique for sending these samples and these swabs to the chemical pathologist. We'll have separate pieces of lungs for the virological culture. That is again very important. And the samples of the ileal contents. Ileal contents are again very important in such a case, but if we have gastric contents on hand, or we have the vomitus that was collected at the crime scene. So these swabs and these cultures have to be taken and they have to be sent to the chemical pathologist for further assays. Autopsy appearances, on the other hand, are again very important in such a case. If there is any sort of a bleeding or any sort of signs of hemorrhages, they're again very important and they have to be noted in detail whenever you're writing such an autopsy. Then again, if you find any vomitus at the crime scene, it is again going to be taken, and whatever sample available has to be taken and sent to the chemical pathologist for the examination and assays. Inconstant froth at the lips and nostrils is again very important, and this froth can be blood tinged and it cannot be blood tinged as well. It is again going to be quite important, because if you're going to send it and some infections can be revealed, it is going to be quite often evidence over here. Fibers sometimes clenched in the face, they're again very important, and petechial hemorrhages on visceral pleura and thymus gland. So these findings, these hemorrhagic findings, they are basically indicating towards the aspiration of the contents and the asphyxiating condition. Thymus gland is again very important. Petechia, or large ecchymotic or ecchymotic patches on the epicardial surfaces of the heart. If they are found, all of these petechial hemorrhages and the ecchymotic patches on the heart, they're going to indicate towards the asphyxiating conditions in such a case. So gastric contents are again going to be taken in detail, and usually milk, curds in the air passages are found in a lot of cases. Gastric contents, if the vomitus is found at the crime scene, because we have a detailed crime scene investigation that has already been performed by the investigating officers. So it is again very important that you see that all of the contents, if they are found at the crime scene, they are sent to the chemical pathologist for further assays. And then if there is no vomitus, then we have the gastric contents at our hand, and we'll be sending these gastric contents in a separate bottle to the chemical pathologist. Then the respiratory infections are again very important, and we are basically looking for the pneumonias or even the congenital abnormalities of the respiratory tract. If they are found, the congenital anomalies of the heart, they have to be highlighted at this level. And even on the external appearance, if the baby is of a Downs or he is suffering from any other syndrome, that has to be highlighted by the autopsy, by the medicolegal officer, whosoever is performing the autopsy in such cases. The respiratory infections are highlighted. Inflamed laryngeal or tracheobronchial mucosas are seen. Then we have to highlight if pulmonary edema is suspected in such cases. And this basically diagram is giving you an overview of every pediatric data, that is the death circumstances, medical story of the child, clinical review, skeletal x-rays, fundoscopy is done. All of this pediatric data has to be collected from the mother. And then the systemic skull CT scan or MRI is done. In case of any abnormality, post-mortem becomes mandatory. And if nothing is abnormal in the pediatrical data, nothing is abnormal, then no autopsy is done. And if the CT scan is normal or the MRI is normal, then no autopsy is done in such cases of SIDS. So these are the features of the Down syndrome, and other abnormalities can also be seen in such a case. So if any features of Down syndrome are seen, or the congenital heart diseases are seen, or other chronic systemic diseases are seen, they have to be documented in detail while you're writing the autopsy report. So the autopsy report of SUDS or SIDS is quite tricky at times, but it was discussed quite comprehensively in this section. That is the end to this section. Thank you for watching sqadia.com.